There's a number of different ways to use his services over there, and we've discussed, varicose veins, spider veins a number of times, and a lot of the other disorders that you may not even be aware are related to vein disorders, such as night cramps and ankle swelling. So a lot of great discussions that I've had with Dr. Pittman. We want to focus today kind of more on the cosmetic aspects of what he does over there. For instance, you're telling me like the little red dots that people get on their hands and face and different places are related to veins.
Yes, they're called cherry angiomas. Most people are just going to say, hey, I got these red dots, and a lot of people have them, all ethnicities. They start as little dots.
Yeah,
look at your arm,
I've seen them on my body too.
They can be anywhere, face, sometimes the worst place.
I kind of just pick at them or something. Is that bad? I guess it's not good to pick at anything.
It's going to leave a scar, but they start as a dot, they grow to be a spot, and then they heap over. And that's why they're called cherry angiomas. So they never go away. They only enlarge over time. And they're difficult to get rid of. A lot of dermatologists really don't want to deal with them. They are overgrowth of capillaries. And we have a device called VeinGogh. It's a very kitschy name.
Just like the artist Van Gogh, huh?
Yeah, VeinGogh. We use that to get rid of spider veins in the face. I'll digress just a second. Ladies spend a lot of time in those mag mirrors. They know every square centimeter of their face. Many of them suffer from spider veins around the nose and in the face and so on and so forth, and it's a source of embarrassment for them. And this device is literally instantaneous and a fantastic device. I've never had patients get up, hug me, or cry. They're so happy before I started getting rid of spider veins in ladies' faces, honestly. But same with the cherry angiomas. It's instantaneous. Like I said, they can be on the face, the trunk. They start in our 20s, and they just kind of get worse. And some middle-aged folks, they look absolutely fantastic, but their trunk or their chest or their back is just filled with these little cherry bumps. And it's embarrassing. They can't put on a bathing suit and go outside.
So you just bring them in and hit them with that VeinGogh machine a couple of times, and they're gone, huh?
In seconds, those things are gone. It doesn't scar; they go away.
And are they reoccurring in the area, or will they pop up somewhere else? Well, what's causing these things then?
Overgrowth of capillaries?
It's genetics, really. Some people say it's bromide. You can talk to some of the nutritionists out there. But at the end of the day, it's an extremely common thing. Like I said, once they start, they don't go away. They only enlarge. And once we get rid of them, they're not coming back. So you're pretty much good to go once we get rid of them, because it takes years and years and years for these things to
Are there
grow.
any other treatment methods other than hitting them with the VeinGogh machine, like creams or anything out there that work with those with cherry angiomas?
There's no creams that I'm aware of, and I don't want to speak for the skin doctors or the dermatologists, but I think dermatologists may scrape them off, with a blade and things like that. But this device is really just super
non-invasive. A couple zaps with the VeinGogh machine, for lack of a better word, and then
couple zaps,
to go.
exactly, and it's gone.